Hi, everyone. It's Dr. Reem Sabouni. I'm so excited to be with you tonight. So today is part 2 of our donor education webinar series, and we're going to be talking about becoming parents with the help of a donor. So let's go ahead and get started. Don't forget, I love answering questions towards the end of the presentation. So in the question and answer section and in the chat function, you can type in your questions and I will read off the questions, and then between Rachel and I will be answering them. And I love that portion of these webinars the most. So I look forward to y'all's great questions. All right, so let's get rocking and rolling. So let's start off with talking about what is egg donation. So egg donation is a female provides eggs that have been manipulated outside of the human body, because let's face it, we're not chickens that just lay an egg, right? So it's a little bit harder to access our eggs. With the intention of producing a pregnancy in a recipient, whether that's an intended parent or a gestational carrier for somebody who's not able to carry the pregnancy for themselves. So the female who's donating her eggs will have no parental rights or responsibilities for any of the resulting child that comes from these egg donations. So that's a good little definition of what egg donation is. So who needs donor egg IVF? So this is not necessarily an exhaustive list, but generally our top ones for who needs donor egg IVF would be women who are postmenopausal, meaning they are no longer having menstrual cycles because their ovarian reserve is depleted. Also women who undergo premature ovarian insufficiency, meaning they go into menopause early, whether it's from historical like chemotherapy or radiation that basically kind of resolved or kind of eliminated a lot of the eggs that they naturally have, versus women who for whatever reason go into premature menopause. Also women who have diminished ovarian reserve. So this is women that in comparison to their age match cohort have a significantly lower ovarian reserve in comparison to other people their age. And remember, we as women, we're born with a set number of eggs that we have, and we slowly lose it over time. So we do not have a capability of generating more eggs. There can be some genetic indications as to why we have to utilize donor eggs. And there's also a group of patients that who maybe have a good ovarian reserve, but they are found to have either poor egg quality or poor embryo quality. So this could be a treatment option that your doctor may recommend for you to try to get you pregnant. People that have had multiple previous failed attempts to conceive with our reproductive technologies. So this is another treatment option. This is another tool in the tool bag. And then also for men who do not have a cisgender female partner or a single man who are planning to use the donor eggs and their sperm and use a gestational carrier to carry the pregnancy. So why I've included this graphic is because a lot of the times when I'm in my consultations with my patients and we're talking about the concept of donor eggs, remember how we talked about that this concept of, you know, we as women were born with the set number of eggs that we're going to have, and we slowly lose them over time. Well, one of the things that's hard for some women to understand is that you still could be having your cycles on a regular basis, but if you are in your, let's say, early 40s, the concern is that egg quality, okay? So we have the capability of measuring egg quantity by like looking at things like your AMH or your anti-Mullerian hormone, which is a blood test, or by looking at your antral follicular count. But remember, we don't have any tests to check for egg quality. And the only surrogate we have that can give us some diagnostic information about egg quality is your age. So the maternal age of which we're trying to utilize eggs. So what's shown in this graphic is that as women get older, not only is their fertility kind of turning down, but their risk of a spontaneous abortion or a miscarriage goes up significantly. And where you kind of have that cross or that intersection is usually around the very late 30s, early 40s. And remember, the number one cause of miscarriage is chromosomal abnormality. And that is all geared towards and kind of related to this whole concept of egg quality, right? So the egg quality is kind of referring to this concept of being able to produce a chromosomally normal embryo. All right, next slide. So how do we find an egg donor? So most of the time when we're having the conversation on the clinical side, talking about maybe utilizing an egg donor, a lot of times people start thinking about known donors. So they're thinking about potentially asking their sister or cousin, or they have a friend twice removed that they potentially want to utilize. So generally, if we're thinking about using a known donor, then it really should be somebody who's under the age of 35. So why a random kind of age or cutoff? Well, as you know, above the age of 35, you have a higher likelihood of having a child with chromosomal abnormality. Hence why they say when you're above the age of 35, you have a higher risk of having a child with like Down syndrome. So they should be under the age of 35. That's not a hard, fast rule, but just something to kind of, but a guideline. They should have no evidence of impaired fertility, because if you're going to take an egg donor through the process of IVF to extract their eggs, you're going to be putting a lot of resources towards trying to get their particular eggs. And so especially if they already are struggling with fertility, then maybe that's not the best bang for your buck, if you will. Now, the next point is a very key point, and is one of the main reasons why using known donors becomes a little bit less desirable, is because you have to have donation agreements in place. So this is very important when utilizing it with a known donor in the cases of if it's a friend or a family member, because they might change their mind about their role in the child's life. Because remember, they're known to you, so that means they have access to you and they can find you, right? And so it's very important in these circumstances that both parties, meaning the known donor and the recipient, have separate legal representation for each party. And remember, the person who pays for all of this is the intended parent. And then also, if the known donor has a spouse, then remember, they have a say in this whole process because they're utilizing their partner's gametes. The other option for how to find an egg donor is anonymous donor. And although most patients kind of come in thinking they want to use a known donor, when they kind of see how complicated and intricate this process can be, most of our patients end up using an anonymous donor. And we'll go through that in a little bit and kind of address those things. So how are egg donors screened? Well, they undergo this very extensive screening process in which we go through their history of birth defects and hereditary diseases that may run in their family. Despite their history, all of our patients undergo genetic screening, or by patients, I mean donors. They undergo genetic screening because we want to make sure that if they're a carrier of a certain genetic disease, then you need to be aware of it to make sure that whatever your sperm source is also not a carrier of that same genetic disease. They undergo a medical and social history examination. They undergo a physical examination. They undergo extensive psychological screening. They get tested for sexually transmitted diseases. And remember, this is an FDA regulated screening process. So it's not something that we just come up with, but it's something that the FDA actually regulates. And they also undergo a urine drug screen. So what are the success rates with utilizing donor eggs? Well, the success rates will vary by a variety of things, just like life, but it depends on the age of the egg, so the age of the donor. So that's why we try to do them below the age of 35. Most egg donors are below the age of 30. The retrieval process in which the eggs were obtained, the quality of the semen. So this is a really important one, especially if when we're looking at a couple, there's also a male factor infertility involved. And especially if you're utilizing testicular sperm, something to think about, because that can also impact your success rates. And the overall health of the women involved. Because remember, even though we think about a lot of the success being tied to the egg, if you're putting the embryo into an unhealthy woman or an unhealthy uterus, because let's say there's cases of endometriosis or fibroid uterus or something like that, or even kind of extremes of age, those can all impact your success rates. But in general, if I was going to give you kind of like a blanket kind of number, up to 48% of women who utilize donor eggs will experience pregnancy. So that's a very general statistic. We can kind of tailor it a little bit more towards your individual case, depending on, kind of the variables that we can get from you and your history. But that's pretty good, because especially if we think about, ideal rates of natural pregnancy, you're looking at 20% a month. So 48% or almost 50% is pretty darn good in my book. So egg donor information that you can find on a lot of different egg donor sites is the race of the egg donor, their hair color, their eye color, their height, their education, their blood type, and they usually include childhood pictures, and then some egg donor sites also include adult photos, which I think are pretty cool. So you can kind of get an idea of what your donor looks like. And this is obviously very dependent on the different egg banks that you go to. They can give you like as much as HLA, antigen type, or all these other different things. But the most important thing is that I would encourage you to explore many different egg donor sites and find a site where you feel comfortable with the information that they're giving you. So you get quite a bit of information. And then the other thing that people want to know about, which is awesome, that HFI has our own third-party reproduction department, because they kind of go through this a little bit more extensively with you as a couple or as an individual, is the different types of egg donation cycles that you can potentially be a part of. So the traditional, or other words for it are dedicated or non-shared donor egg cycle, will essentially be where you pay for all of the eggs obtained from a donor from a single IVF cycle. So that means that you incur all of the costs of taking a donor through an IVF cycle. So you pay for all the medications, the procedure, all that stuff, and the compensation for the patient or for the donor. But the benefit of that is you get all the eggs. And usually when you're talking about using an egg donor, they tend to be young. So you tend to have a high ovarian reserve, and hopefully you'll get a good amount of eggs. So that means that you can hopefully create many blastocysts or embryos, so that you have not just enough for one embryo transfer, like not just for one pregnancy, but maybe even siblings as well. So you can maybe get a few pregnancies out of it. So that's kind of the advantage of a traditional dedicated or non-shared donor egg cycle. Now, a shared donor egg cycle is generally where you're splitting the eggs from a single IVF cycle amongst multiple couples. So obviously you can imagine there's some cost sharing, so it's less money for each individual couple, but then the amount of eggs that they get from that stimulation will, depend on the clinic. I think the really important thing to kind of mention at this point is that when we think about the different types of donor egg cycles, not all fertility clinics are equipped to be able to handle all these different types of cycle, because it takes a lot of resources and they maybe don't have access to the donors or things like that. So it's really important where you go to see what kind of different donor egg cycles are available to you. We're very fortunate at Houston Fertility Institute in that we have a dedicated team and we have our own egg bank. And so we offer all of these different types of cycles, but we'll go into that in a little bit. So The shared donor egg cycle, as I said, you're splitting the eggs from a single IVF stimulation from a donor. Now, a frozen egg cycle, you can have the option of doing dedicated versus shared. The eggs are already frozen. The donor has already gone through the stimulation, the retrieval. We already know how many eggs they retrieved. And then at that point, you can decide that you want to, have all of the eggs, or if they've already kind of given out, if you will, some of the eggs from that cycle, you can use that shared option to get a certain amount of eggs from that particular donor. The advantage of the frozen egg cycle is the fact that things have already been proactively done, right? So you basically have the egg. All you need to do is fertilize it and then grow it out to become blastocysts, and then you're ready for transfer. So typically when you're looking at cost savings and time to transfer, your frozen egg cycles are probably going to get you to that pregnancy a little bit sooner. The last one that I should mention is an agency donor cycle. So the whole purpose of utilizing an agency donor cycle is usually when you have really small fertility centers that don't have a dedicated donor program or donor department. And so they force their patients to have to utilize agencies. So you have to use kind of another party to help you find your donors. So with these agency donors, you tend to pay higher premiums because you basically have a middleman that is taking a cut of some of the fees. But with the agency donors, you might be able to do the traditional or the shared donor options. All right. So you find your donor. Congratulations. It's a very exciting process. So what's your next step? Well, we still need to do prenatal labs on you, assuming that you're going to be carrying the pregnancy yourself, or you might be utilizing a gestational carrier. But if you're going to be carrying the pregnancy yourself, then we have to take a look inside of the uterus to make sure that the uterus cleared for your embryo transfer. So we usually do a uterine cavity evaluation. We can do that a few different ways, whether it's a hysteroscopy versus a saline infusion sonogram. And then you have the option of either doing a synchronized frozen embryo transfer, which basically means that you can fertilize the egg, grow out the embryo, and by the time the embryo becomes a blastocyst, we'll have already prepared your lining of the uterus to be receptive for that blastocyst at that time. The advantage of synchronizing it and doing a quote unquote fresh embryo transfer is the fact that you don't have to freeze that embryo again prior to transferring. So every time you freeze and thaw, that can potentially insult the embryo. Now, a frozen embryo transfer or frozen FET is more commonly done just because it helps with in terms of timings and things like that. So essentially, whenever you're ready for your embryo transfer, after you fertilize the egg and grow them out to become an embryo, then we basically prepare the lining of your uterus with estrogen, followed by estrogen and progesterone. And then we do your embryo transfer. 2 weeks later, you find out if you're pregnant. Now, with a frozen embryo transfer, one of the advantages of that is that if you wanted to do pre-implantation genetic testing, then you have to freeze the embryos because you have to wait for you in theory should be waiting for the results to get back before you decide to transfer that embryo. So that is your next step. Now, as I mentioned, Houston Fertility Institute, we're very fortunate that we actually have our own egg bank. Now, the purpose of this egg bank is actually as a courtesy to our patients, because obviously this is unfortunately something that we deal with relatively commonly. And so instead of us having to send our patients to use agency donors or have them waiting extremely long periods of time until we can track down a donor for them, we started our own egg bank. So it was founded in 2011 as a service to our patients. We're very hands-on with each of our donors. We really do treat them like family. One of our big advantages is we use local donors. So it's really cost savings for our recipients and our intended parents, because if a donor is to travel or have to be put up in a hotel, that's additional cost that would come out of the recipients or intended parents that they would pay for. One of the things that we heavily track is for all of our donor eggs that come from our own egg bank, we know proven outcomes. So we can tell you if each donor, if they not only have a kid, but if other patients have utilized that same donor and have had pregnancies, like successful live births from that donor. So that's, I think, really important information to have, because if somebody has been successful in the past or are proven, then you have a higher likelihood of being successful in the future moving forward. As I said before, we have dedicated donor egg nurses, and we have a dedicated donor department and third-party reproduction department. So again, this is a large practice, and we have a large portion of our patients that do utilize donors. So it's important for us to have our own department that exclusively deals with that. In our egg bank, we do provide eggs in cohorts of 8, which is nice, because I think in most of the national egg banks, they give you 6 eggs in a cohort. We have an assurance policy in place, so we have a little bit of skin in the game as well for your success. And then also, one of the things I think is super awesome is not only do they provide childhood and adult photos for the donors, but also 100% of donors who have biological children, they also have photos of their kids as well. So I think that's really fun. It kind of gives you a little bit of an idea of what to expect, but that's really a neat thing. So common reservations that we commonly hear on the clinical side about utilizing donor eggs is, how do I know I need donor eggs? Well, remember, that's more of a conversation that you're going to have with your doctor. If you are wondering if you need donor eggs or you want a second opinion, then please come in for a consultation. We would love to talk about your individual case and see if that's an option for you, or if there's some alternatives. Will this treatment work? As I said, that's very individualized. So it's really on a case-by-case basis if donor eggs is for you or not. And more importantly, is there alternatives so that we can kind of help you accomplish your goal? How long does the process take? Well, if you're utilizing that frozen egg, as we talk about, that will probably be the fastest way to get pregnant. So probably as short as maybe a 2-month process, maybe even less if you have your ducks lined up. But if you're utilizing, if you're wanting to do a dedicated cycle and take a patient through a simulation, then it depends on the availability of the donor. And it can take a little bit longer, maybe towards maybe 4 to 6 months. How hard is it to select a donor? I think that when it comes to donor selection, it's again a lot of factors in play, including what it is that you're looking for in your particular donor. So if you have features that you're looking for that are a little bit harder to find, maybe it might be a little bit more of a challenge, but one that our donor team is up to help you with. Can I afford it? I think that's a very common question. What I would say is we're very fortunate that we have financial counselors that can kind of help break down the costs for you. And one of the things that I personally think is pretty cool about this donor egg process is that when you buy the eggs, you're also buying the IVF portion, meaning the fertilization of the eggs. That's included in the price, and also included in the price is a transfer. So the point is it's all kind of a lump sum that you pay, and it gives you a lot of things, at least if you go through the HFI Egg Bank. If you go through an outside egg bank, you obviously pay for the eggs from whatever egg bank you go with, and then you have the IVF fees and things like that with Houston Fertility Institute. So that's something the financial counselor can get with you for individual details and see if you have any insurance coverage for it. And then how to talk about donor eggs. I think that's an important one. I think that a lot of people kind of have a hard time, or maybe some have a harder time than others, kind of wrapping their mind around this donor egg concept. And we do have resources to psychiatrists or psychologists that you can sit down and talk with and kind of explore your feelings about it, and maybe explore your feelings with your partner, so you can see if that is a right option potentially for you.